Well, good afternoon, everyone. Minister Haggie will be joining us from Gander today, and we have the Chief Medical Officer with us, and Dr. Fitzgerald will provide the information on the overnight update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining. Since yesterday. So since our last media briefing, we have 4 new positive cases. These cases are within the Eastern Health region. Public health contact tracing is ongoing, and everyone considered close contacts will be asked to quarantine. The total number of cases in our province now is 256. By region, we have 238 in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. And by age, we have 22 people under the age of 20, 37 people between 20 and 39, 37 people between 40 and 49, 56 people between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 7 people are in hospital, and of these, 3 are in intensive care. 176 people have now recovered. In total, we have tested 5,585 people. The collaboration each of us has shown over the past month has and will continue to be the cornerstone for how we navigate COVID-19 in our province. Though it calls for patience and determination, this slow and steady approach is working, and the early signs are positive. If we remain vigilant in our efforts, we will persevere. We can do this, but we must do it together. Please continue to do your part. Wash your hands often, cover your coughs and sneezes, stay in your bubble except for essentials, and maintain safe physical distance at all times. Please, and I cannot stress this enough, stay home if you have flu or cold symptoms. These tried and true measures are our best protection. If you must go out for essentials this weekend, try to shop during off-peak hours or look at curbside pickup options within your community. If possible, have one adult within your household to do the shopping and keep your children at home. If you are going to expose your family to something this weekend, let it be sunshine and fresh air and not COVID-19. Please remember that physical distancing does not mean social isolation. So I encourage you to look for ways to find togetherness this weekend without gathering, and to stay virtually connected with family, friends, and neighbors. If you can, spend some time outdoors. Take a hike, work around your home, sit outside with a good book. Take time for self-care. It will do wonders for your well-being, both physically and mentally. If you are going to get out and enjoy nature this weekend, please do it safely. If you go for a hike, do it with people in your bubble. Don't congregate in trailhead parking lots. Stay at least 2 meters or 6 feet from anyone who isn't in your bubble. Of course, please remember all the principles of hiking safety that still apply in this time of COVID. I have been quite impressed while on my own treks by people respecting the principles of physical distancing. While COVID-19 has profoundly changed life as we know it right now, it has also forced us to slow down, reflect, and reconnect with family members within our own bubble. It has provided us with an opportunity to spend quality time with each other, learning new things and growing together. Even on days with dark clouds, I hope we can all look for these silver linings. I would like to acknowledge and congratulate today the many college and university students in our province who are finishing final exams in the coming days. I commend you for your continued dedication to your academics during this uncertain time. While the day to reunite with your classmates and friends to celebrate successes will come, now is not the time. Your accomplishments are certainly cause for celebration, so please act responsibly by celebrating your achievements within your family bubble and perhaps a virtual celebration with everyone else. And now that I've sucked all the fun out of finishing exams, I'll recap cases. As a recap, for those who may have just joined us, we have 4 new cases since yesterday's media availability. The total number of cases in the province is 256. The breakdown by health region brings us to 238 cases in Eastern, 8 cases in Central, 4 in Western, and 6 in Labrador-Grenville Health. With each passing day, I am inspired, but not at all surprised, by the restraint, determination, and selflessness displayed by the people in our province as we face COVID-19 together. If we remain united in our efforts, I'm confident we will not only stay the course, but will forge ahead better and stronger than ever. Our collective actions will have a significant impact on how COVID-19 progresses in our province. Thank you.
Well, thank you, Dr. Fitzgerald, and good afternoon, everyone. So today we have 4 more people who have been tested positive for COVID-19. So this is 4 more people that received the call from someone. These people then had to go and tell their family, to go and to explain to their friends about their contact. This then led to, of course, the contact tracing information would have been required. To do that, we need to make sure that we stay social with one another. As Dr. Fitzgerald has said, we need to take care of each other and support each other during this difficult time. I did an interview this morning with CTV, Your Morning it was called, and I spoke about the resilience of the people of Newfoundland and Labrador. And as you know, we have weathered many storms, and we can do it again. And although that we've been internationally known for the great work that we did in 9/11 that come from away, globally people are know us as a very generous and a very friendly people. But right now, it's unusual for us as Newfoundlanders and Labradorians because now we're asking people to actually stay away. But we know that in time, we'll get back to some degree of normal lives. Now, it might be a new normal, but I'm confident we'll have no problem adjusting. There are a number of things on hold in our province for good reason, but we still have to make plans and still look ahead. And that's why today that as a province we will be releasing the list of provincial road projects planned for the 2021 construction season. And so some of you might question, you might ask, why now? This is simply to allow contractors to prepare and start work when the construction season begins. Now, what we must all keep in mind, including the contractors, that every single person is required to follow the guidelines to help prevent the spread of COVID-19. Work will only proceed when contractors are able to demonstrate that they can provide safe working conditions for their employees. So right now we've released 11 projects. We have another 10 tenders that will be issued in the coming days. And there will be a news release going out shortly, and it will provide the complete list of projects that are planned when the construction season can safely begin. The information will be posted on the Transportation and Works website. As you know, the construction industry contributes significantly to the provincial economy. And this year, more than ever, investments in improving highways and bridges and construction of new schools, health facilities around our province, this will help support work for much needed for local businesses. So by continuing to issue and award tenders, it allows our contractors, allows people in Newfoundland and Labrador to plan for their expenditures and to reassure the labor pool about the plans for the upcoming road construction season. But we must do it safely. When we are building critical infrastructure while ensuring proper health protocols are in place, this is only then can we prepare and move forward with our construction season. Another reminder as we head into this week, and we want you to remember, aside from following the guidelines, we have to think about our actions, and our words often affect one another. Now, in a typical society, there's a lot of peer pressure. There's preconceived notions that someone just doesn't look normal. All of us are different, and that's okay. That makes us special. It makes us unique. And I get a lot of emails from people around our province, and from time to time we get a few that would really stick out. A few days ago, I had an email from an individual who admittedly said that he was a large man, overweight, had asthma, was having a major impact on his life. He also went on to say that he was now afraid to go and get groceries and other essentials. He said that it wasn't because he was a fear of contracting COVID-19. He said it was coming from people being confrontational and being judgmental. You know, there's a lot of stress and anxiety in our society today. So for his health and safety, he made a decision, even though he wasn't a senior, but he was vulnerable, he was high risk. He made a decision to do his shopping at the seniors' hour. So in times like this, I'm kind of reminded how much of an impact this could have, and our own actions and words can have on someone else. So as a society, I think we need to be more understanding, more accepting. As the saying goes, you can't judge a book by its cover. Together, we have to accept the imperfections of others, and we have to be kind. And not just now during this pandemic, but we must do it even when we get out of this. And in doing so, we must recognize and continue the work that we are different as a people. But we also must recognize the great work that people do in our society. And once again, on Sunday of this week, the Confederation building will be lit up yellow. And that is to recognize the amazing work of our essential workers. And like last weekend, we'll be putting out a news release on Saturday and Sunday. So this will be about the numbers and the briefings. Instead of the briefings that we would normally do between 2 and 3 o'clock, over the weekend, both on Saturday and Sunday, we will put out a news release with the updated numbers of cases in Newfoundland and Labrador. So they will go out around 2 o'clock on Saturday and Sunday. And if need be, if something that should happen that is a bit abnormal, we will be available to address the public, of course. But over the weekend on Saturday and Sunday, we'll put out our numbers around 2 o'clock. So I encourage you now to have a safe weekend. Please keep physical distancing. Keep that top in mind. Please stay socially connected with seniors and some of the most vulnerable in our society. Keep your safety of you and your family front and center in every action that you do. So I now take this opportunity to pass it over to the Minister for a few comments.
Thank you very much, Premier. Before I make my comments, I'd like to draw people's attention to the fact that it is actually World Haemophilia Day today. We have a significant population of people who have haemophilia in this province. Indeed, there are several in my own district, some of whom have very severe forms of the disease. Because of this, blood donors are still needed, among other reasons. Blood.ca is a website that has been adapted by Canadian Blood Services to meet the needs of donations during the time of COVID-19. It makes some suggestions and recommendations about what people should do if they wish to donate blood. Appointments are still being made. They will be done in a safe, physically distant way as far as is possible, and done to protect both donors and staff. But also, there are some restrictions now around who can donate if they have been exposed to COVID. And I would encourage you all, firstly, to give blood, and secondly, to check out their webpage at blood.ca to help support this community as well as others. We use a lot of blood in this province over the course of a working week, and we're always challenged, being an island, to make sure we have a supply. We've continued again to see cases, and I think that speaks to both the benefits and successes of past measures, but also the challenge to maintain those going forward. 811 we have used extensively during the COVID crisis to provide additional information, but it is there also and was founded to help people get medical advice out of hours for a wide variety of issues. If you have a reason to call 811 and you think you may have been exposed, it's important that you bring that forward during the discussion with the healthcare provider. We have adapted 811 for people with disabilities, and I referenced the other day the TTY line. It occurred to me afterwards that this is kind of old technology, and in conjunction with the Newfoundland and Labrador Association for the Deaf last year, we had talked about what's called a visual relay service. So technology such as this can be used to connect people who are not communicating through sound, but by sight. and that visual relay service is available to people who wish to use 811. The details on how to access it can be found on the 811healthline.ca webpage. Premier has already referenced about accommodations for people who have challenges when they come to go out and do shopping. And another issue that's been brought to my attention, both locally and through the Canadian National Institute for the Blind, is that of visually impaired people who require, obviously, groceries to live just like you and I would. It is not unusual for them to need a service dog or a support dog, but it's also difficult for some to shop without a person, a support person to help them. And while I know we've all been very enthusiastic about saying one shopper per household, again, like with all things, there is a degree of adaptation that has to be recognized for people whose sight might not permit them to read labels in a way that will make shopping possible without support. 911 is and always has been there for emergencies, and I would encourage anybody who feels acutely unwell to use that number to the exclusion of all others. Certainly, ambulance numbers that you might see on your fridge from years ago, 911 is the number to call. Again, mention exposure or potential exposure to COVID is key so that our staff and first responders can protect themselves as well as you by putting on the appropriate PPE, which every frontline ambulance carries. One of the other things in this time of relative physical isolation is if you are on a range of medication, to prepare a list of these in advance and maybe just stick them on a fridge with a magnet. I know some provinces have these kind of arrangements. We've never done that formally, and maybe that's another learning to come out of COVID-19. Premier referenced the whole issue of reopening the province. I think we are nowhere near ready to discuss that. We know there's a 2-week lag for whatever measure we have taken in relation to COVID-19, and that we are not anywhere past the Easter weekend, which I think will show us very clearly how resilient we may or may not have been. It is a question at the moment of holding the line. Having said that, we as a government have been having discussions about how a gradual and very staged relaxation of these restrictions and orders could come about. It would be key, again, to rely on isolation and identification of cases of COVID-19, gradual relaxing of orders in a way that made sense and was scientifically backed, and also the use of controls about travel across our provincial borders. Each of these things have been the subject of discussion. So, again, following with Dr. Fitzgerald and sucking all the fun out of graduation, I propose to suggest that the next May 24th weekend, which in actual fact will not be May 24th, but is only 4 weeks away, will not be a typical traditional Newfoundland holiday. And I would encourage people now to think of ways that they can use the principles of physical distancing and social connectedness to plan how they might wish to enjoy that weekend, because it is unlikely that it will be anything like a May 24th weekend we have had before. We need to find new ways to connect. So again, I just conclude by saying you and your family, your household need to make a protected bubble. You need to stay in it except for essential trips, and you should not burst anyone else's bubble. It is important at this trying time that we hold the line, realizing that what we do now will not be obvious in its effect for at least 2 more weeks. So with that, Premier, I'll turn it back to you. Thank you.
Thank you, Minister Haggie, and we now open it up to the media for questions.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they were registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m. and further questions can be emailed. Our first questions today are from Peter Jackson of the Telegram. Please go ahead. Peter, if you would press star 1.
Is this thing working? Okay. I'm just wondering, based on the new cases that you have in contact tracing and other indicators in those, whether you can tell any of them are early incubation results of the Easter weekend.
The investigations are still ongoing through public health. I don't know that the information is related to Easter weekend at this point. Some of the symptom onset actually happened before Easter weekend for some of those cases. So, but I'm not sure if all were related to any kind of activities over the Easter weekend.
Okay, thank you. And Premier, I wanted to follow up. You made a suggestion yesterday, I believe, that you might have new information with respect to dispensing fees. Is that correct, or
yeah, yeah. So we're working with with some pharmacists and with the Department of Health and others too. We recognize that the 3 months or the 30-day supply has left a financial impact on many of the people that would require prescriptions. Of course, this really comes down to how you manage drug shortages. And so, first of all, we need to make sure that we have a good supply of medications for people that need them. But also, there's an impact if you go to a 30-day supply. There's an impact on staff within the pharmacies themselves that actually dispense this medication. But it's also an impact on those people that would have to pick it up. And so it kind of flies in the face of some of the things around, making lessen the number of stops that we'd want to see, for essential items like prescription drugs. It's an impact on how these things are delivered, how they're picked up. So, as we can lessen the number of trips that you'd make to those shops, that's important for all of us. And, given the experience that I would have had over the years, doing this in a similar nature, I also know that pharmacists are more than willing to be there to work with, the people that the clients and the patients that they have. And so right now is how we manage the drug shortages and lessen the number of trips to pharmacies. So we don't have all the details. They're not available yet. But, hopefully we can work with the association and pharmacists to make sure that the people that need the medications and the 90-day supply, that they can get them, but also make sure that we make provision for those items that are being short. So you might see a combination of a lesser supply for the drugs that are shortage, but yet those that are in adequate supply, you could go back to a 90-day supply.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
We've heard from several dental associations that they can only prescribe so many pills and some medications over the phone. Some procedures are going to need to be done immediately here, but they're worried about PPE. Is there any access for them for more PPE to conduct some of the procedures they need to do?
It's a very good question, Kellyanne. There's two threads to that. One is we're working with the Dental Association on the issue of virtual care, virtual assessment, so that people can be seen virtually and assessed for treatment needs. But equally, there is discussion around how best dental offices should provide emergent or urgent treatment. Certainly, that is a clinical decision left with the dentist. In terms of PPE, we have begun discussions with the Newfoundland and Labrador Dental Association, and we would be happy to entertain any requests for PPE. We do have kits both for frontline workers in home support, for example, or personal care homes, as well as family physicians who are independent of the RHAs, and we would regard the dentist as little different in that regard. Those discussions actually only started really within the last week, at that level around how to provide virtual care and looking at moving from, as I said before in other contexts, what wasn't urgent on the 6th of March may well be now. And that's a clinical decision. So we're working through that with the dentist.
Thank you. And Premier Ball, in terms of helping the oil industry through this COVID pandemic, Trudeau announced money to help Newfoundland and Labrador's oil sector to reduce emissions. Your response to this?
Well, what I saw this morning, I did have a call with Minister O'Regan this morning. This is really about a release today of environmental issues. So we have two things here. This is about addressing orphan wells in places like Alberta, Saskatchewan, and British Columbia. There's a little bit there on how we reduce emissions within the oil and gas industry. But what we're looking for as an industry here in Newfoundland and Labrador is one a bit more future thinking, how we remain competitive, how we attract investment to Newfoundland and Labrador, how the companies that actually work in this sector have the liquidity that it needs to be successful and be competitive, and also around exploration. Exploration for us is something that we see as key to the future of the project of our offshore industry. And so it's about investments, attracting investment, maintaining the competitiveness of Newfoundland and Labrador, and also about getting the regional assessment that would be completed. These are all necessary components for the future. So what we're seeing released today is primarily about some of the cleanup work that would need to be done in out west. So there's a considerable amount of work and money that will be spent on cleaning up those sites, but for us, our focus is on future of the offshore industry in Newfoundland and Labrador. And my understanding now is, speaking to the minister, we could expect more information on what the offshore Newfoundland and Labrador and where you see federal participation in the next week or so.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
There are no ICU beds in Labrador. Why is that, and what's the plan if there happens to be an outbreak there where a number of people require that level of hospitalization?
Another good question, Peter. We, in actual fact, have ventilators and have had for years in St. Anthony, Lab West, and in Goose Bay. There are physicians and staff there who can manage acutely ill patients through the acute phase and get them established on ventilators. But because of critical mass in terms of population and illness and disease burden, those patients have usually, historically, been medevaced out of the Labrador area. And that's been the case for decades. At the moment, we have no indication that that system could not continue. And we are looking, as we do daily, with our ICU bed availability. Traditionally, those patients have, by and large, either gone to St. Anthony or have gone on into St. John's. Occasionally, they've gone to Gander. We currently have an ICU bed occupancy of only 29%. We have the ability to create more capacity in established referral centres if that's necessary. But this reflects basically the small population, the small disease burden in Labrador, and the fact it's actually very difficult to keep intensive care unit clinical skills up unless you have a much bigger population.
For some people, chiropractors, massage therapists, physiotherapists are essential for them to stay healthy. Some of those people are healthcare workers who are working long hours on the front lines and may need that sort of care in order to be able to continue to work. What's the plan to be able to provide essential care for those areas?
We've looked at that. In actual fact, it was a subject of discussion at several levels yesterday around just that particular issue. We would work with the professional associations that represent each of those groups over the course of the next few days to see what would be a sensible way of doing this. Again, it's a question of moving from the acute phase, as it were, where we shut down things, knowing that at some point, 4, 6, 8 weeks into this pandemic, we would have to re-examine that. And this is the re-examination phase. So you can expect developments in those areas over the course of the next working week.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Fish Harvesters Safety Association says that harvesters will find out today about new safety rules during the pandemic, assuming the fishery goes ahead. Dr. Fitzgerald, you would have reviewed those rules. What do you think of them? Are you worried about any specific measures? And are there any of the measures that are soon to be announced that you think are particularly important for harvesters to be following?
So we did have conversations with fish harvesters representatives and other groups working in the fishery. We have reviewed their guidelines that they have developed on their own for safety with regard to COVID-19. We have made suggestions for how we think things may be changed or improved a little. On the whole, it appears that these associations have put a lot of work in, and they've done some careful thought and consideration into how things can be done safely. And ultimately, it'll be up to companies and employers to ensure that these guidelines are followed.
And Dr. Fitzgerald, in your role, you're having to make decisions about a wide array of industries, often with some very unique circumstances. The fishery is just one example. Can you talk to us a little bit about what that experience has been like, and how difficult it's been to adapt to so many different circumstances?
When we're looking at safety, we go back to our basic public health principles. So we talk, in this case, we talk about physical distancing, we talk about careful hand washing, we talk about reducing the risk of spread by wearing masks and those sorts of things. So we have our basic principles that we have to go back on, fall back on. And, I certainly don't have expertise in many of these industries. So all we can do from a public health point of view is provide that advice. And then we have to leave it to the industry to be able to adapt their practices to be in keeping with that advice and to provide the safest possible working environment for their employees. So it's been a learning experience, I think, for everybody at the table. But on the whole, I think it's been quite positive.
Our next questions are from Allison King of VOCM News. Please go ahead.
Premier, can you provide any update on long-term care homes since your meeting with the Prime Minister yesterday?
Well, if you're thinking about the essential workers and some extra pay that would go their way, if that's your question. Well, when we had a lengthy discussion both with our fellow colleagues, the premiers across the country, and with the Prime Minister last night, and there were a couple of subjects that were raised, but this was one about federal programs and the impact within the province. So when you look at healthcare workers in our province, if you look at the hourly rate, it would be around $15.63 before this would have any impact. So essentially $2,500 a month. So we know within Newfoundland and Labrador, most of our healthcare workers would be a little more than that, a little more than $2,500 a month. So really right now it's on a cost-shared basis. So we need to work out more details. And if we're going to really offer something to those essential workers, and this would include some of our food store workers as well. So there's still some work that would need to be done on this, but at the very high level, this is where, with the information that was discussed last night. So if indeed this is something that's going to be put in place throughout the country, I think we need to be able to make sure that we hit the target, we hit the mark that we're looking for, and as it exists today, that many of our healthcare workers that would be recipients of a program like this, who worthy recipients of a program like this, would probably not see the impact that we'd like to see, but we made a commitment to continue to work with the federal government on this program.
Thank you. My other question, other provinces have scaled back their work week from 5 days to 4, reducing some spending to perhaps 20%. Is the provincial government considering this?
Yeah, I think you're probably thinking about a program that Manitoba was considering for public sector workers. So they were looking at going to of a 5-day work week. 3 would be working with the public sector within their work that they do, and 2 would be probably participating in some kind of a federal program. That's not something that we're thinking about right now. We have a number of people that are working from home, still providing services to Newfoundlanders and Labradorians. So right now, that's not a program that we're thinking about. But you never know what the future will be. But at this point in time, we value their work, and we must keep in mind too that anything that would come from a program like EI some of that would have to be repaid too. So this is not something that we have in our plans right now.
Thank you.
We have a little bit of time left, so instead of going to single questions, I'm going to allow each reporter to ask 2 more questions each, and we'll start with Peter Jackson of the Telegram. Please go ahead.
Hello.
Peter.
This has been brought up before. You say that you can't, it's almost impossible to monitor home care workers who are handling multiple clients. What advice or guidelines would you suggest for people who are receiving this home care and are seeing different people come into their home over the span of time?
Hi, Peter. From the point of view of home care workers, you'll recall that we have changed very much the requirements now for both long-term care facilities and personal care homes, whereby a single worker is confined, an individual worker is asked to work on one site only and is not able to go back and to. The challenge with home support is similar. What we are trying to do now is work both with the home support agencies to identify those clientele who would be served by different care workers and wherever possible move to the same care worker providing care on over a course of time. So the number of different individuals involved in care would be limited. But the facts of the case are we have discussions to be had about PPE, recommendations for people with home care workers who they manage themselves. There is extensive literature available. The home support agencies have a director in each of the regional health authorities with whom they should be talking and are talking to get that information. And as far as the individuals who manage their own home support are concerned, their point of call, their contact is their own individual case manager, the individual who would normally come and visit them on an intermittent basis to reassess care needs. There is PPE available, and again, we recognize it's going to be a challenge, but we are working hard through those routes to try and cut down the number of different interactions with different home clients.
Okay, thank you. And this is something that came through social media. I came across someone who wants to volunteer to help with any kind of non-medical things involved with contact tracing or anything. Are you actually taking that kind of help from people who just want to lend a hand?
We're always open to help. I think the question is where an individual skill set would have the best use. We're certainly expanding training to non-traditional people for example, getting swabs. And also there's been discussion about contact tracing too. And there are people prepared, A, to teach it, and B, to be trained. We had actually originally expanded the pool of potential to people who were in healthcare, maybe as, for example, final year nursing students or medical students. We've certainly had both those organizations volunteer. And as well, we have a rapid relicensing program for people whose skills in that area but have subsequently retired. At the moment, we're not challenged in terms of numbers of people to do that. But if anybody has a skill set they'd like to offer, I would suggest they email that to covid19info@gov.nl.ca, and there is a mechanism there where that could be directed appropriately.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I received an email today from an EMS worker in a community in rural Newfoundland who is concerned about PPE, wondering if the masks, gowns, and gloves that Newfoundland will be receiving will be allocated to rural ambulance services. they say they've made an order before the pandemic, and it could be some time before they get that. If they don't receive more PPE, they might have to halt their services.
No, the ambulance service in this province is divided into three groups of providers. There's the Regional Health Authority ambulances, which are staffed and allocated through the RHAs. There's community ambulance operators and private ambulance operators. They each have their own supply channels, which are separate, usually from the RHA. What we have done, we have undertaken to supply kits to any frontline ambulance in community or in the private sector, and there is a pool of resources there that can be deployed. In addition to that, I do know that there are channels through which private operators would be ordering. But again, like our supply chain, they've been challenged with orders that have disappeared or have been delivered late or in reduced numbers. So I would say that any ambulance operator should be in regular contact with either our department or their regional director of paramedicine to ensure that their supply needs are met. At the moment, my understanding is we will be able to meet those needs at our current burn rate.
Thank you. And I've received this question from multiple people now in the public. They're wondering what the rules for cabinet ministers traveling to and from their districts during the pandemic is, if it's considered essential travel.
Well, I'd love to answer that one, Kellyanne. Thank you very much. The bottom line is I would love to have hidden in my corner in the house for the last 4 weeks and stayed put. But unfortunately, we are working in an environment where that is not possible. I will leave it up to others to judge whether or not my presence in Confederation Building is essential. But we have finally got the technology into at least the 20th century, so I can do a lot more of my work from here. But until very recently, there has been no conceivable way that I could fulfill the responsibilities the Premier has placed on me or the expectations of the general public by sitting in my kitchen and hiding.
Yeah, so
Thank you.
I could just maybe expand on that a little bit there, Kellyanne, because right now you will see a very, very few, if any, really, except for Minister Haggie there, a cabinet presence anywhere around Confederation Building. They're doing as little travel as possible, even around their districts for that matter. Their constituency assistants, for the most part, are working from their homes, as well as the executive assistants. And you know what? We've found very creatively that we can actually do this. And so if need would be that we needed to do something that required a more face-to-face meeting, well, yes, that would be my call. But right now, except for Minister Haggie, there's really no need for me to call cabinet ministers to St. John's. And so therefore it would be essential travel only, and that would have to be something, that would have to be dealt with urgently. Right now we're able to use technology and even our own telephones, as Minister Haggie is using Skyping in today. So we're being as creative as possible, recognizing that, our own footprint around travel must be as small as possible.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
With people doing all the physical distancing, hand washing, etc., I think a lot of people are wondering, how is this disease continuing to spread? I know you're still doing contact tracing on the most recent cases, but can you give us a sense over the last week, the people who are catching this disease, how's that happening?
So this disease can be spread fairly easily, and people may only be mildly symptomatic and not really realize that they are sick with it and pass it on. Sometimes that these people are related to travel, so they've traveled back from an area where the disease is more widespread, and so have developed symptoms after they've gotten home. But like with any disease, it can spread from person to person. And as much as most people, I believe, have been following the rules of social distancing and doing a very good job, there are still some who are not able to or have not. And so we will still see some spread of this virus while it is circulating in our community.
With the trend showing that the curve is being flattened, is it possible that the funeral home cluster was our big surge?
I would be hesitant to say that. I think We have done a lot of work, and all Newfoundlanders and Labradorians have done a lot of work to try to curb the spread of this disease. And I think, what we're seeing now is a product of that to some degree. But I think we certainly can't assume that that cluster was our peak. We may very well start to develop more cases as time goes on. And as we've opened up our testing, we may discover more cases because we are testing more. So we have to be cautious in making that assumption. Absolutely.
So, Peter, if I could just add a comment to that, I think there's one thing that all of us as Newfoundlanders and Labradorians, that we can learn a lesson from what happened at the funeral home. And we also see as we go across the province and we get our daily updates of what's happening, over 30,000 cases, in Canada right now, and over half of those cases would be in, when you look at long-term care homes and so on. You look no further than Quebec and see what's happening there. So, really it just highlights the fact that we just need to be careful. We have to be responsible, practice, physical distancing. That is, that's our best tool that we have right now. And so let's not assume anything at this particular point in time. This virus is alive, and it spreads quickly, as the chief medical officer has said, within no matter what location, what province, or what community you're in. So let's be careful. Let's be responsible. That's the best tool that we have right now.
I'd just like to throw another comment in there. I think from a biological point of view, we need to get away from the idea of waiting this out. This virus is here. It isn't going anywhere, and it will keep coming back from time to time. The big worry is when it comes back, how ready we are to deal with it. And when it comes back, whether or not the vaccine that we've made, ultimately, hopefully for this strain, will work against a new strain if that happens. Because if this is going to be like the changes we see every year with the flu, we're going to have to reconfigure our healthcare system.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Update on temporary foreign workers and measures in place for those workers in Newfoundland and Labrador.
So right now there's a number of temporary foreign workers, I guess, that could potentially be used by application, in Newfoundland and Labrador. Right now, with the number of people that we have out of work, I'm guessing, as I've always said, this would always be something as a last resort. But any traveler that would come into, be it temporary foreign worker or otherwise, that will come into our province, if need be, they would have to, of course, go through 14 days of self-isolation, and this would be at the expense of the employer. I know the federal government has put some supports in place in areas that would need, and that was the only option. But right now in Newfoundland and Labrador, given where we are with so many people out of work, the need for temporary foreign workers, I'm sure, if needed at all, would be very little.
And could you also give an update on developmental and physical assessments for newborns? I know vaccinations are still happening, but in terms of those other services, has there any change on that front?
I would be happy to get you some clarity around that, Patrick. My understanding is that they're not, but I would defer to the practicalities of the RHA. I will get you that information. Certainly, again, one of those issues of if it has been suspended, you can't suspend these indefinitely. And we've been very keen around vaccinations, for example, to make sure that they go ahead as planned. Our challenge has been where those have been given to grade students in a particular year through education rather than necessarily directly through healthcare employees. But I'll find out for you and we'll let you know.
Thank you.
Our next questions are from Allison King of VOCM News. Please go ahead.
Can you speak to the level of care being provided by staff in nursing homes? We're hearing some stories that seniors are not being given the same level of care now that families can't visit.
I think that's obviously a major concern to families. From my point of view, I have no evidence or no information from the RHAs that there has been a lessening of care. There may be a lessening of contact simply because there are no visitors to fill in the gaps between care or meal times, these kind of things. but I'm not aware that our staffing levels in long-term care have altered for the worse in any in any persistent way since COVID-19 came. Certainly, there are day-to-day management challenges of people not turning up or coming in sick, being off sick. But I'm not aware of a systemic issue.
Thank you. My next question, some municipalities have resumed recycling and others, such as CBS, have not due to a lack of PPE for their staff. I was wondering, Dr. Fitzgerald, if you had any recommendations when it comes to using PPE with recycling, and if you would even consider this service to be essential or non-essential.
So what we know about with regard to recycling, it's a little bit different. If we're talking about the routine curbside recycling, certainly wearing gloves for picking it up, having the gloves on, and is certainly appropriate. When it comes to sorting recycling, that's a little more concerning, and there are some guidelines that are available for that. But ultimately, as I've said before, we give guidelines, we give recommendations, and then employers, whether that's municipalities or other employers, would have to take those guidelines and determine how they could do that safely for their employees.
Thank you.
For the benefit of reporters, we have time for 2 quick questions, so I ask you to press *1 and identify yourself. Operator, do we have any questions?
We have Kellyanne Roberts.
Thank you. Thank you. Mr. Haggie, you spoke yesterday about elective surgeries and at some point having to look to open this up. Are we looking to use different facilities to do that? I know in St. John's, for example, a lot of health sciences where the COVID unit is. Could St. Clair's not take some of those elective surgeries and do them there?
That's an issue that's been examined through the RHAs. There are other areas where there are 2 facilities in reasonable proximity to each other where one is designated as the initial COVID receiving facility. The challenge at the moment is around the concept of the surge and when it comes, because we don't know the magnitude of it. What we do know is the more successful we are now and the longer our numbers stay lower, when that surge does come, according to all the models, be they provincial or national, that the surge will be lower. However, we do know that some models would suggest that we would need all our available hospital beds to be able to cope with that. So to fill even a non-COVID facility, designated such, with folk with planned procedures would be challenging until we know or can get a better estimate of when and if that would happen. Having said that, there are surgeries still going ahead in terms of cancer surgeries, bowel surgeries, and these kind of things that clinicians, surgeons deem cannot wait. That's a clinical decision made on a case-by-case basis. I think should we have a better idea of the magnitude of a surge and whether or not we would have facilities spare, as it were, we certainly are not going to sit and leave them idle, but we need to have a better handle now on what may happen in the future. And as I've said repeatedly, the crystal ball we're using is nowhere like crystal clear.
Thank you.
And we have one final question. Operator, who is the reporter?
There are no further questions registered at this time.
Thank you very much for attending and for tuning in. We invite you to join us tomorrow at 2 p.m. Oh, sorry. No, we're going with news releases tomorrow. We'll get you to join us on Monday at 2 p.m., 1:30 in Labrador. Have a great weekend.